Everyone, so am I audible? Is the screen clear so that we can start the session? Let me just check. So yes, let me just check, am I audible? Is the screen clear so that we can start the session? Okay. Yeah. Okay, so my dear aspirants, this is the session of Clinical Anatomy MCQ series part 2nd. Okay, so yes, I am audible and everything is okay so that we can start the session now. So all of you can attend this session. You can write your messages if anything you want to understand, you want to know. So you can just write your messages and you can let me know. Okay. So yes, now let's talk about the Clinical Anatomy MCQ series. So this is the second part of Clinical Anatomy MCQ series. So here myself Dr. Monalisa, I have done my MD Anatomy from Armed Force Medical College, Pune, and I am here to discuss the Clinical Anatomy MCQ. So firstly, I would like to tell you about the special class features. So when I am talking about the special class features, it is important that you should understand what are the benefits of joining the special class. Okay, what are the benefits of joining the special class? So yes, if I am talking about the special class features, so when we are talking about the special class features, it's an interactive session where the learners and educators can interact. Okay, it's an interactive session where the learners and educators can interact. Okay, polls are conducted among the learners. Raise your hands, get your doubts cleared, and also never ever miss a session. So lecture notes and PDF notes are given to you. So for that you are like never you can miss any of the lecture notes. So once the session is finished, PDF notes can be downloaded, and anytime anywhere you can study from the top educators of Unacademy platform. So for attending the free special classes, you can use my code ANAT10. Now what I want you to tell about today I have taken 2 High Yield Anatomy MCQ series, that is 11th and part 12th. That timing was 12 p.m. and 1 p.m. And also I want you to tell about Conquer NEET PG 22 High Yield Anatomy MCQs part 2, that is taking place today. Now itself I am taking the 4 p.m. session. Now one more important point is that this will be followed by 5 p.m. So exactly when I will complete the session, in the next 3-4 minutes or 2-3 minutes, I will get connected with you on the Unacademy app, which is called as Open House, where we will discuss important topics of the lower limb, targeting your examination, NEET PG. Now I want to give you the information about All India mock test, which is going to happen on 19th Feb 9 am. 19th Feb 9 am is the timing. You can enroll in this test by using the code ANAT10. So you can get enrolled for this test by using the code ANAT10. My dear aspirants, I would also like to tell that about the plus subscription. What are the benefits of joining in the plus subscription? When I am talking about plus subscription, all 19 subjects are completed in a very systematic way. You can access both the live and the recorded version of it. It will be highly beneficial for you. So you can be the part of these sessions. It will be highly beneficial for you. And also you can study from India's top educator. You can compete in live test and quizzes. This is you can compete in live test and quizzes. You can study on the device of your choice. You can assess more than 25,000 MCQs, which is made by the top educators, and a detailed explanation is provided for each and every MCQs. Coming soon, the printed notes will be provided to you, and that would be highly beneficial for you. Let's talk about Iconic subscription. When I am talking about Iconic subscription, Unacademy and the Prep Ladder is merged. Okay, in this subscription, Unacademy and Prep Ladder is merged. So what does that mean? That means you get the benefits of Unacademy and you also get the benefit of Prep Ladder. Okay, clinical integrated session essentials, dream notes, printed notes of the Prep Ladder, rapid revision, QBank 3, means all the benefits of Prep Ladder along with the plus benefits of the Unacademy. You get 2 benefits of the 2 best platform. So just get this subscription, use my code and add 10 for extra 10% discount. I would also like to tell you about before giving further information, I want to share this slide where I want to congratulate the toppers of FMG December session. So when I am talking about the toppers of FMG December session, it means that they have got the capability of cracking the exam of next or NEET PG in the first course. So all the best, my dear aspirants. Now, NEET PG subscription plus an iconic comparison and the pricing detail has been shown to you. Use this code and get 10% discount extra. Now, highly updated QBank is there on the platform of Unacademy. So, have an access to 25,000 more MCQs based on latest pattern of exam. Includes a detailed explanation for each and every MCQ. Use this code and add 10 and get enrolled for this test. And my dear aspirants, also you can take the subscription and get an extra discount by using this code. So, let's start with the first MCQ. So, when we are talking about the first MCQ, this is the question number 1. Okay. So, let's talk about the first MCQ. This is the question number 1. Okay. Now, what is there? Question number 1, I will read it for you. A 45-year-old woman is admitted to the hospital with a difficulty of breathing. Radiological examination reveals a tumor invading the lung surface anterior to the hilum. So, which nerve is most likely compressed by the tumor to result in the dyspnea? The nerves are phrenic nerve, vagus, intercostal, recurrent laryngeal nerve and cardiac plexus. So, we have got 5 options as you can see here. Okay, so I will provide you with 30 seconds and then you can give me the right answer. So, I will provide you with 30 seconds. Okay. Okay. Okay, 5 options are there. So, what is the answer according to you? So, the key point which is given here, is a tumor invading the lung surface anterior to the hilum. So, which nerve is compressed by the tumor? We have got 5 options: phrenic, vagus, intercostal, recurrent laryngeal nerve and cardiac plexus. So, according to you, which is the correct answer? So, whether it is phrenic, vagus, intercostal, recurrent laryngeal or cardiac plexus, please mark the correct answer. Okay. So, my dear aspirant, it's the phrenic nerve. Let me show you the image so that you can understand its relations of the phrenic nerve, vagus nerve towards the hilum of the lung. Okay. So, when we are talking about phrenic nerve, see here, right vagus nerve, when we are talking about vagus nerve medial to, here in this diagram, what you can appreciate that vagus nerve is medial. Okay, when we are talking about this, so you can clearly see, okay, I got an answer from students. Sam has given the answer, Sonu, Alam and Farhad Parvez, okay, and Sam, okay. So, here the correct answer is phrenic nerve, and in this diagram you can see here that the phrenic nerve is passing anterior to, okay. So, phrenic nerve was A, so I got an A answer from Sonu, Alam and Sam, absolutely correct. So, very clearly you can appreciate that the phrenic nerve is passing anterior to the hilum and lying over the pericardium. Now, the other options are wrong. You can see here that the vagus nerve is crossing posterior to the hilum area. So, it's quite clear that phrenic nerve is the correct answer and vagus is wrong. Intercostal can't be the right answer because it is lying in intercostal spaces and groove. Recurrent laryngeal nerve is also not the right answer because it's a branch of vagus nerve and it is having different course on right and left hand side. I will show you the diagram. The left recurrent laryngeal nerve is winding around the arch of aorta and right is winding around right subclavian artery. Cardiac plexus, we have got superficial and deep cardiac plexus, and I would like to show you a diagram of the location of the cardiac plexus. So, let's see that. So, okay. So, yes, my dear aspirants, here you can see this is the left recurrent laryngeal nerve which is winding around the arch of aorta. So, in the left hand side it is winding around arch of aorta, and in the right hand side it is winding around subclavian artery. So, yes. Now, cardiac plexus, as you can see, this is a diagram showing you the location of superficial cardiac plexus. So, superficial cardiac plexus, as you can see, it is lying below the arch of aorta and in front of the pulmonary trunk bifurcation. Now, see this deep cardiac plexus. When I am talking about this deep cardiac plexus, it is located just anterior and anterior to the tracheal bifurcation. So this is exactly the location of the options which is given, and clearly we can mark that the correct answer is phrenic nerve. Let's move on to the next MCQ. That is question number 2. All the best, my dear aspirants. Okay, okay, so let's talk about the second one. A 39-year-old woman visit the outpatient. 39-year-old women visit the outpatient clinic and complains of inability to reach the pantry shelf just above her head. Okay, history reveals that 2 months ago she underwent mastectomy procedure, and she did not have this complaint prior to the surgery. But after the surgery, what was the complaint? The complaint was that she was not able to reach the pantry shelf. That means overhead abduction is affected. Overhead abduction is affected. So my dear aspirants, according to you, which is the correct answer? I am getting answer from the aspirants. So according to you, which is the correct answer? Whether it is A, axillary, spinal accessory, long thoracic nerve, radial or thoracodorsal nerve. So Farhad Parvez has given the answer. And he is absolutely right. Long thoracic nerve. Actually, we know that overhead abduction. So the hint provided in this MCQ is that overhead abduction is affected, and we know that overhead abduction is done by serratus anterior muscle, along with which muscle? Trapezius muscle. So these are the two muscles which is responsible for overhead abduction. So you can tell me that why not B is the right answer, spinal accessory nerve, which is also giving innervation to trapezius muscle. But this is not the right answer. Why? Because you can see here the procedure is the removal of the mammary gland, that is mastectomy, and in mastectomy the nerve which is injured is long thoracic nerve. So we will go with long thoracic nerve because it is the innervation of serratus anterior muscle. So see this diagram here, you can clearly appreciate. So here in this diagram you can clearly appreciate that long thoracic nerve, this is serratus anterior muscle, and it is getting innervation from the nerve which is running over it. So this nerve which is running over it is the long thoracic nerve. So the reason is long thoracic nerve injury occurring when the procedure of radical mastectomy is done. There is an injury to long thoracic nerve in this procedure, and this will lead to serratus anterior muscle injury. Yes, hello Tripti, hello Muzamil, everyone. So yes, we have got the correct answer here. The serratus anterior muscle is paralyzed. Let's move on to the next, that is question number 3. Question number 3. A 23-year-old male is evaluated after sustaining a neck and shoulder injury. Okay. So the nerve indicated by the blue arrow on the illustration below is injured in this patient. So which of the following is most likely to get weakened in this case? So the options provided is flexion of hand, abduction of fingers, extension of hand, adduction of thumb, opposition of thumb. So which is the correct according to you? Which is the correct answer according to you? So I will give you, so please mark the correct answer. Your time starts now. Please mark the correct answer. Okay. Okay, so yes, I am waiting for the answers. Okay, Tripti, Muzamil, Farhad, Pravez, Sonu, Sam. Which is the correct answer according to you? So which is the correct answer according to you? Which is the correct answer according to you? Which is the correct answer according to you? So yes, anyone? So let me tell you the answer here. So the key point which is given is the arrow. Arrow is the key point. So that means you have to identify that nerve. So this is a, so I got an answer from one of the student, Aruna. So yes, now let me tell you the correct answer. Let me solve it for you. So first thing is that you have to know the identification of nerves of brachial plexus. So the diagram which is shown you is the brachial plexus. So actually this is the nerve which is the radial nerve. So actually the correct answer will be extension of hand will be affected. So I will just Okay. So, so I will just enlarge this diagram. So, see here, I am enlarging this diagram. Is it okay? I am enlarging this diagram for you, and let me give you the correct identification. So, yes, radial nerve. Dr. Kostub has given absolutely right answer. It's the radial nerve. So, firstly, we will see here, this is the C5, this is C6, this is C7, this is C8, and this is T1. So, these are roots. These are what? These are roots of brachial plexus, and here the branch of the nerve will be LTN, long thoracic nerve. I will write in short form. Is it okay? And this is the DS, means dorsal scapular nerve. So, if I talk about the roots, so I will just use this red color for the roots. So, this is the roots. Okay, these are all roots of brachial plexus. So, got it? We have also got the branches from the roots, and we have seen the roots. Now, so we have done with this. Now, the next is the trunk. So, for the trunk, you can see C5 and C6. Here C5 and C6. So, here C5 and C6 is forming the upper trunk. C5 and C6 is joining and forming the upper trunk. C7 alone is forming the middle trunk, and lower trunk is formed by joining C8 and T1. So, what is it? These are trunks. These are the trunks. Okay, this is upper trunk, this is middle trunk, and this is lower trunk. So, the branches from the upper trunk will be SS, suprascapular, NS, what is this? NS, that is the NS will be. So, NS will be which nerve? NS is this, that is nerve to subclavius. So, NS will be nerve to subclavius. Got it, everyone? Okay. So, we have done with the identification of the roots and the trunk. What is next is the division. So, let's see the division. So, here these are the anterior division. So, this is the anterior division, and both anterior division, and this is the anterior division of lower trunk, and here in other diagram what I want you to show, these are the posterior divisions of all the three trunks, and the posterior division together is forming the posterior cord. So, this will be the posterior cord. So, here you can see, here in this diagram, these are DVI, divisions. Okay. So, here we have got the division. So, this is the anterior division. This is also anterior, and these are green color is for the posterior division. So, posterior division of is all joining to form. So, this will be the posterior cord. This will be posterior cord. The anterior division of the upper and the middle trunk, this is forming the lateral cord, and the anterior division of lower is forming the medial cord. So, this is medial cord. So, we have got all the three cords. So, let's see the branches of individual. So, let me use, firstly I would like to show you the branches of lateral cord, branches of lateral cord. So, yes, let me use blue color for it so that you can understand. So, see here. Got it? See here. So, the branches from the lateral cord will be, this is the lateral cord, and the branches of lateral cord will be following. So, this is LPN, lateral pectoral nerve. Which nerve is this? This is musculocutaneous nerve. This is musculocutaneous nerve. Now this part, this is half of the, actually when you will see the median nerve, so this is the lateral root of which nerve? Median nerve. Which nerve is this? MN. MN means median nerve. So, this is the lateral root of median nerve. Okay, done with this. Now, okay, Tripti, what is the topic, ma'am? Whole anatomy? Yes, MCQ is mixed. Clinical anatomy. MCQ is whole, it is a mixed version of it. Okay, now we will see. Now let me tell you about the medial cord. So, see here, median nerve medial part, median nerve medial part here is forming the medial root of median nerve. So, this is the medial cord. So, let me tell you about the branches of medial cord. So, got it. So, we have got 5 branches from the medial cord, and here the branches are, this is the medial root of median nerve. So, median nerve is taking contribution from both medial cord and lateral cord. So, this is again medial pectoral nerve, this is medial cutaneous nerve, or this is medial cutaneous nerve of arm, This is medial cutaneous nerve of forearm. This is medial cutaneous nerve of forearm. And this is ulnar nerve. This is ulnar nerve. So got it? All the branches of medial cord also we have got it. What is left behind, my dear? The posterior cord. Now let's see the branches from the posterior cord. So I will use this color, brown color, for the posterior cord. So this is showing you all the branches from the posterior cord. This is what? This is the posterior cord. And now let's focus on all the branches of posterior cord. Okay, now the arrow marked nerve is the largest. So if I enlarge slightly, the arrow marked nerve is the largest. The arrow marked nerve is the largest branch of posterior cord. So the this is what? RN, radial nerve. This is what? AN, axillary nerve. This is what? This is a lower subscapular. This is upper subscapular, and this is thoracodorsal nerve. So TDN. Okay, so if you enlarge, see here, this is the branch. So if I am enlarging it slightly, but you can understand this, let me show you the, see here. So we have got the branches from the posterior cord: axillary nerve, radial nerve, LS means lower subscapular, US means upper subscapular, and LTDN means thoracodorsal nerve. So now is it clear to you the nerve affected in this diagram? Which is the nerve which is affected in the diagram and which was asked in the MCQ? Is it clear to everyone? The nerve is radial nerve. So what is the action of radial nerve? Radial nerve is causing extension of finger. So what will be lost in this image? The characteristic feature which will be lost and affected is extension of hand, because the nerve affected is radial nerve. Got it, everyone? So let's move on to the next, that is question number 4. A 45-year-old female presents to your office with numbness of right palm. After taking a detailed history and doing a physical examination, you suspect a medial nerve lesion at the wrist. Before reaching the wrist, the medial nerve courses between which of the following structure? Okay, so my dear aspirant, this is asking about the course or course of the nerve. So you can see numbness of right palm after taking a median nerve lesion at the wrist. So already the nerve involved is given, median nerve lesion at the wrist. So already the nerve which is involved in this case has been given. So we have to know about the course of median nerve coursing between which of the following structure to reach the wrist. So this is the key point which has been asked in this case. So these are the highlighted points. So please read the 5 options, that is, it is passing between biceps and coracobrachialis before reaching the wrist, passing between flexor carpi ulnaris and flexor digitorum profundus before reaching the wrist, passing between flexor digitorum superficialis and flexor digitorum profundus, passing between olecranon and medial condyle supinator or head of radius. So according to you, what you feel, which will be the correct answer, my dear aspirant? Please mark the correct answer. Your time starts now. Which is the most correct answer, dear? Which is the correct one? Mark the correct answer. Okay, waiting. So actually the correct answer is flexor digitorum superficialis and flexor digitorum profundus. The correct answer will be flexor digitorum superficialis and flexor digitorum profundus. Okay. Now, okay, Tripti has given C with a question mark. Tripti, you are absolutely correct. The correct answer is flexor digitorum profundus and flexor digitorum superficialis. So absolutely correct. So C is absolutely correct answer, dear. Let me tell you about median nerve in brief and show you this relation. So when you in the forearm, when you will see the course of median nerve in the forearm, it is passing deep to the tendinous arch. It is actually passing between the two heads. It is passing deep to tendinous bridge, which is formed by the superficial, which is formed by humero-ulnar and radial head of flexor digitorum superficialis muscle. So if you will see, I have highlighting this diagram. This is the humero-ulnar head and this is the radial head of flexor digitorum profundus, and in between and just passing deep to it is the median nerve. This is the course where you can see the median nerve is coursing. Now what was exactly asked in the MCQ? The course when it is passing just before the wrist. So see that in forearm it descends between FDS and FDP. It is descending between two important structure. One is FDS and the other is FDP. Now just 5 centimeter above, it is exactly passing between the FDP and FDS. So let me show this. Okay. So exactly we have to give the correct answer here will be C, because the course before reaching the wrist is between the two important muscles of forearm. One is FDS and other is FDP. Got it? Let's move on to the next, that is question number 5th. A 15-year-old boy who is a bodybuilder has a dream of one day becoming a professional bodybuilder. Okay, to that end, he begins an intensive abdominal workout routine consisting of sit-ups and crunches to develop his six-pack. Okay, Tripti. Okay, I am coming to your point, Tripti. So, the muscle that this adolescent is isolated in his workout to get six-pack look attaches to which of the following skeleton areas? Okay, actually Tripti, upcoming session are so have you subscribed to Let's Crack NEET PG? Tripti, have you subscribed to Let's Crack NEET PG? Okay, so you will get the notification in Let's Crack NEET PG YouTube channel also, the upcoming session, or in the Telegram group you will get, or also you can have the notification in all the groups. So you can be in the Telegram group and you can get the notification there. Always I put the link of the session. I personally before the session, so I inform you before a day, or also I inform you 6-7 hours before, 5-6 hours before, and just when I am beginning the session, once more I share the detail of the upcoming session. So it is there. So you just you will get that notification of YouTube sessions also. So you must subscribe to Let's Crack NEET PG and Future Doctors of Unacademy, where you get the upcoming session link, and also in the Telegram group of Unacademy. Okay, yes Tripti, you have subscribed. So you are you a member of Telegram group of Unacademy? There you will get the notification. Telegram group of Unacademy. There you will get the notification. All the group. Okay, so yes, now the options are iliac crest. Okay, so yes, mark the correct answer. Mark the correct answer, A, B, C, D, E. Which is the correct answer? D, costal cartilage to 7 to 12. Okay. So actually firstly you identify the muscle. The muscle which we are talking about is rectus abdominis muscle. Which is the six-pack muscle? Rectus abdominis muscle. Okay. So I will go up with the correct answer, xiphoid process. Okay. There can be confusion of xiphoid and costal cartilage, but we definitely know that rectus abdominis muscle is attached onto the xiphoid process. So we will go with xiphoid process as the correct answer. See here. So actually it is written 7 to 12 costal cartilage. So exactly the costal cartilage is 5th, 6th, 7th. Okay. So if exactly, so we will go with, here you can see this is the xiphoid process. So xiphoid process. So we are knowing that it is also inserting, rectus abdominis is the muscle which is inserting into the xiphoid process, and also it is inserting into the costal cartilage 5th, 6th, 7th, and it takes origin from the pubic symphysis. It takes origin from the pubic symphysis. So this is about the origin insertion of rectus abdominis muscle. This is all about the origin insertion of rectus abdominis muscle. And so if we have to pick one, I will go with rectus abdominis muscle xiphoid process. That would be better. Okay. Okay, so if I have to pick one, I will go with xiphoid process as the most correct answer. Let's move on to the next MCQ. All the best. So here, before moving to the next MCQ, let me just elaborate you about the origin. So if I talk about the origin of rectus abdominis muscle, so we are talking about rectus abdominis muscle. Okay, so rectus abdominis muscle origin is from the crest of pubis inserting into the costal slips of 5th, 6th, 7th costal cartilage and also xiphoid process. Okay, arterial supply inferior epigastric artery, which is a branch of external iliac artery. Okay, nerve supply, thoraco-abdominal nerve T7 to 211 and subcostal nerve. Action is flexion of lumbar spine. Action is flexion of lumbar spine. So actually xiphoid process will be the better option because costal cartilage right number was not placed in the option. So we will go with xiphoid process as the most correct answer here. Let's move on to the next, that is question number 6. A 56-year-old man come to the emergency department because of persistent left wrist pain. Okay, left wrist pain. While walking his dog 5 hours ago, fell forward to the ground and landed on his outstretched left hand. Examination shows mild swelling over the dorsum of the left hand with preserved range of motion. There is a point of tenderness over the anatomical snuff box. So key point is mentioned here. Point of tenderness is over anatomical snuff box. Point of tenderness is over anatomical snuff box. Okay, so this is the key point which is mentioned here. An X-ray of the left wrist is done and shown below. The patient is at greatest risk of developing which of the following complications? Okay, whether the patient is developing avascular necrosis, carpal tunnel syndrome, compartment syndrome, Dupuytren contracture or osteomyelitis. Which is the right answer here? So Dr. Kaustubh has given his answer and he is telling that this is a case of scaphoid fracture and he is giving A as the answer. So my dear, Dr. Kaustubh is absolutely right. He is perfectly right. Avascular necrosis is there, and actually the whole clinical history which is provided, the key point is that tenderness of our anatomical snuff box, that is the key point to locate exactly the correct answer. So yes, tenderness on anatomical snuff box means that the fracture of scaphoid bone has occurred. So if you will see, I will just show you this image. This is the radiological image which has been shown here. In this case, this is the radiological image which I am just highlighting, enlarging it so that you can better understand. So see here, if here clearly in this image, this is the radius bone which is seen. Here clearly in this image, we can say this is the outline of ulna bone. So that is clear here. Radius and ulna bone is clear. Now let's talk about the identification of the carpal bones. So as we move, so that means this is L for lateral and this is M for medial. Now this bone which you are seeing here, which is fractured here is the scaphoid bone. So this is the lateral most and this is the scaphoid bone which is fractured here. So now this will be lunate. Now this will be the pisiform and pisiform, P for pisiform, and this is triquetrum. Now lateral most, so this will be the outline of trapezium. This will be the trapezoid. This largest bone will be the capitate, and this hook like, this is H for hook of Hammett. So got it everyone? H for hook of Hammett, capitate. So we have got all the 8 carpal bones, and the fractured carpal bone which is seen in this image is the scaphoid fracture. Is the fracture of scaphoid 1. Okay, fracture of scaphoid 1 as we have seen in this image. So now let's see. So here, why avascular? Actually, one of the important complication of fracture of scaphoid bone is that if the proper treatment is not provided to the patient as early as possible, so what will happen? The fractured scaphoid will happen, and what you can see here. So in this case also, what you can appreciate that here is the radius bone, and here you can see this is the scaphoid bone which is fractured. So actually in case of scaphoid bone, it is having a very peculiar arterial supply or nutrients. So you can see the branches from radial artery, scaphoid, dorsal branches and branches from the palmar arches, and there is actually the arteries are entering. If you will see, the course of the artery is entering from the dorsal aspect. So when the waist or the neck of the when the waist and the neck of arteries are fractured, what you can appreciate here, that the scaphoid bone fracture, it will lead to the affecting or injury of arterial supply to scaphoid bone, which can lead to avascular necrosis in the proximal region. So the most common and actually long lasting cases or untreated cases can also have arthritic changes because of this avascular necrosis. So we will mark the correct answer A. So in this case, clearly we are knowing the fractured scaphoid bone has been seen in the image, and the complication and the presentation is anatomical snuff box tenderness. So we will go with the A as the correct answer, avascular necrosis, which is already given by many of the aspirants and the students, and you are perfectly correct. Avascular necrosis is the correct answer. Let's move on to the next one, that is question number 7th. Question number 7th. A patient has been diagnosed with jugular foramen syndrome, which occurs when a tumor compresses the nerve passing through jugular foramen. Okay, the tumor compresses the nerve passing through jugular foramen. Got it? Okay, which of the following autonomic deficit is the patient most likely present with? Okay, the patient most likely present with. Okay, whether it is a case of dilated pupil, whether it is a case of an eye that is dry and red, whether it is a case of ptosis, whether it is a case of loss of sweating on the side of the face affected, or reduction of parotid gland secretion. So key point which is mentioned here is jugular foramen syndrome. So what is the other name of jugular foramen syndrome? It is also called as Wernicke syndrome. So already the syndrome is mentioned, and you have to tell me the presentation of the patient, and all the 5 options are given. So please mark the correct answer. What will be the case? What will be the abnormality seen in the patient? Whether it's a case of dilated pupil, eye that is dry and red, ptosis, loss of sweating on the side of the face, or reduction in parotid secretion. According to you, which is the most correct answer? This is a case of Wernicke syndrome. Please mark the correct answer. I got an answer from Pravez. Pravez is telling it's C, ptosis. Okay. What about others? What about others? So first thing, how you are approaching to the correct answer, I will tell you. Can you tell me which nerves are passing through jugular foramen? Tripti, absolutely correct. Tripti is absolutely correct with her answer. Can you tell me which nerve passes through jugular foramen? The nerve passing, 3 nerves passes through jugular foramen. What are they? 9th cranial nerve, 10th cranial nerve, and that of 11th cranial nerve. Okay, so parotid gland secretion will be affected. And can you tell me, actually glossopharyngeal nerve is responsible for parasympathetic innervation of parotid gland or secretomotor fibers. So here 9th cranial nerve is coming out from jugular foramen, and in this case there will be compression of 9th cranial nerve. That means secretomotor fibers will be affected in this case. Yes, Tripti, and parotid gland secretion will be reduced in this condition. So we will go with E as the correct answer. See here, a lesion in the jugular foramen will affect 9th, 10th, 11th cranial nerve. Cranial nerve 9th, glossopharyngeal nerve, is carrying preganglionic fibers for the parotid gland. So when it is affected, there will be reduced secretion from parotid gland. You can see here, glossopharyngeal nerve, via glossopharyngeal nerve, the preganglionic fibers is arising from inferior salivary nucleus, and via glossopharyngeal nerve, tympanic plexus, via the petrosal nerve, the fibers will relay in otic ganglion, and via auriculotemporal nerve, it will give parasympathetic innervation to that of parotid gland, and it is very important nerve giving secretomotor fibers, and the most of parotid gland secretion is forming the saliva, which is the watery in consistency. So absolutely correct. So this is the reason why we have got the 9th cranial nerve and parotid gland as the correct answer. Other options are perfectly wrong. So the wrong option, like pupil dilatation, the choice A is wrong, because we know that dilatation of pupil is a sympathetic response and it is related to 3rd cranial nerve. So this is the wrong option. Why? Because we know the constriction of pupil and dilatation of pupil. When we are talking about dilatation of pupil, it is a sympathetic response and it is indicative of 3rd cranial nerve injury. It is not related with that of 9th cranial nerve. Now, dry red eye is also not a case. Dryness of eye, redness, these are all seen in cases of Bell's palsy, that is 7th cranial nerve. These are the features of 7th cranial nerve involvement. So this will be not the correct answer. drooping of eyelid or excessive tears. Actually, LPS is the muscle, levator palpebral superioris is the muscle which is supplied by third cranial nerve, but here the forehead muscles and all seventh cranial nerve, and also you can see drooping of the corners of eye. These are the features of Bell's palsy. Now, the choice ptosis is again when we talk about LPS is affected, levator palpebral superioris having innervation by third cranial nerve, and drooping of eyelid is the one of the features of Horner syndrome also, and when the third cranial nerve is involved, then only ptosis will be the right answer. So definitely here after this explanation it is quite clear that the correct answer will be E in this case. Is it okay everyone? Okay, let's move on to the next, that is question number 8th. All the best dear aspirants, all the best. So let's move with the 8th number MCQ. Okay, I will read it for you. A 9-year-old female presents to your office complaining of right hand clumsiness. Right hand clumsiness. Physical examination reveals decreased sensation over the fifth finger and a flattened hypothenar eminences. Flattened hypothenar eminences. The affected nerve is commonly injured at which of the following location? Affected nerve is commonly injured in which of the following location? Okay. So what is the correct answer? A. Carpal tunnel, B. hook of Hammett, C. surgical neck of humerus, D. head of radius or coracobrachialis. So the key point, let me highlight the key point. Right hand clumsiness, decreased sensation over the fifth finger and hypothenar eminences. Hypothenar eminences. So which is the common affected nerve and which will be the correct answer? So my dear aspirants, 30 seconds I will give to you. Please mark the correct answer. 30 seconds provided. Mark the correct answer, dear. Okay, waiting for your answer. 30 seconds I will give to you. Otherwise, I will come up with the explanation. So, Tejashri has given the answer B. Tejashri has given the answer B. Hook of Hammett. Okay, Tejashri is here with his answer. What about others? What about others? So, can I come up with the answer? So, yes, hook of Hammett is definitely the correct answer. My dear aspirant, hook of Hammett is definitely the correct answer because the structures, so here decreased sensation over the fifth finger and flattened hypothenar eminences is the key point. My dear aspirants, in our hand, this is the thenar eminences which is formed by thenar muscles. Okay, this is hypothenar eminences which is formed by hypothenar muscles. Hypothenar muscle is getting innervation from which nerve? Ulnar nerve. Hypothenar muscles are getting innervation from ulnar nerve. My dear aspirants, also when we talk about cutaneous innervation, this is the medial 1.5 on the palmar aspect and 1.5 onto the dorsal aspect, including the nail buds. So 1.5 dorsal fingers and dorsum, and 1.5 of the fingers, medial fingers, and that of the medial part of palm is getting innervation from ulnar nerve. So both decreased sensation over fifth finger. So that means decrease, that means a case of decreased sensation over fifth finger is also due to ulnar nerve, and hypothenar muscle is affected, it is also due to the ulnar nerve. So the correct answer will be hook of Hammett because the Guyon's canal, if you remember, Guyon's canal is an important anatomical landmark where there can be compression of ulnar nerve. Okay, Guyon's canal is the important landmark or area where the nerves can be compressed, So we have got hook of Hammett as the correct answer. Okay, let me show you further explanation. So I am going with the further explanation about details of the Guyon's canal. Now, carpal tunnel is not the right answer. Why? Because it will be affected in median nerve. Carpal tunnel syndrome, which nerve is affected? Median nerve. Hook of Hammett is correct because ulnar nerve is affected here. Surgical neck of humerus is wrong because it will affect Axillary nerve. Head of radius is wrong because it will affect the radial nerve. Coracobrachialis is wrong because it will be affected when musculocutaneous nerve is affected. So only the right option is B, that is hook of Hammett. Got it? I have also the all other option I have made, I have ruled out, and the correct option let's come up with the more explanation. So here in this case, ulnar nerve provide, as we have already discussed, ulnar nerve provides sensory innervation to the 5th digit and medial 1.5 or 4th digit on both of the palmar and dorsal aspect. In hand, when we are talking about hand, in hand, ulnar nerve innervates all palmar interossei muscles of hypothenar eminences, palmaris brevis muscle, 3rd and 4th lumbricals and adductor pollicis. So actually ulnar nerve is very important nerve for innervating intrinsic muscles of hand. Actually most of the muscles of the hand, all palmar interossei, all dorsal interossei, the muscles of hypothenar eminences. The name of hypothenar muscles are abductor digiti minimi, flexor digiti minimi, opponens digiti minimi, 3rd and 4th lumbrical muscles, adductor pollicis. All these are the major chunk of muscle which is lying in the medial side, and palmaris brevis muscle, which is a very small muscle lying in superficial fascia. It is an example of panniculus carnosus muscle. The muscle which resides in the superficial fascia is called as palmaris brevis muscle, is one of the example of panniculus carnosus muscle. So all these muscles are getting innervation from ulnar nerve. So we will go with ulnar nerve as the correct answer. Now, in the wrist, when I am talking about the course of ulnar nerve in the wrist, it passes between the hook of Hammett and pisiform bone. Actually, the space which is lying between, the space which is demarcated between the hook of Hammett and that of pisiform bone, it is called as fibroosseous canal, and this is called as Guyon's canal. This location is called as Guyon's canal. This location is called as Guyon's canal. Now, ulnar nerve passes through the Guyon's canal and is responsible for causing dyskinesis of the decreased sensation of the ulnar side of the hand, and it is also one of the reason of weakness. It is one of the most important reason and the reason of weakness of the intrinsic muscles of the hand and hypothenar muscle. So here Guyon's canal syndrome, and the nerve affected is ulnar nerve. Actually, in Guyon's canal, both ulnar nerve plus ulnar artery passes. So this will be compressed in Guyon's canal syndrome. Is it okay? Let's move on to the next. Can we move on to the next MCQ? That is MCQ number 9th. A 33-year-old male slips while working in his yard and falls on outstretched hand. Okay, he slips, falls on outstretched hand. He later presents to the emergency room complaining of right shoulder pain. On physical examination, there is flattening of right deltoid muscle and insensitivity of the overlying skin to the pain prick. Which of the following injury is most likely responsible for the case? The options are anterior dislocation of humerus bone, acromioclavicular joint subluxation, clavicular fracture, spiral fracture of the humeral midshaft, fracture of coracoid process, rotator cuff tear. What is the correct answer? Question number 9. So the key point which is mentioned here, flattening of right deltoid muscle, insensitivity to the skin covering over that area, flattening of right deltoid muscle, insensitivity of the skin to the pain prick in this area. So which of the following nerve is most likely responsible for this condition? Whether it is anterior, whether this is a case of anterior dislocation of humerus, whether it is a case of acromioclavicular joint subluxation, whether it is a case of clavicular fracture, spiral fracture of humeral midshaft, fracture of coracoid process, or rotator cuff tear. So according to you, which is the best answer here? So Parvez is telling it's F, rotator cuff tear. What about others? What about others? Okay, please mark the right answer. I would like to drink some water. Please mark the right answer. 30 seconds for you. Okay. So yes, so both of you are telling F. Okay. So let me explain the right answer. Actually, the key point which is mechanisms of injury, and there is flattening of right deltoid muscle. So can anybody tell me what is the nerve, what is the reason of deltoid muscle paralysis? Deltoid muscle paralysis. So when is deltoid muscle paralyzed? So can you tell me which nerve is supplying deltoid muscle? Which nerve? Axillary nerve with a question mark. Absolutely right, Arundhati. Okay, yes, deltoid muscle, absolutely right, says that it is getting innervation from axillary nerve. So actually axillary nerve having the root value C5 and C6, which is a branch of posterior cord of brachial plexus. It is a branch of posterior cord of brachial plexus. It is giving innervation to deltoid muscle. Not only deltoid muscle, it is also giving innervation to teres minor muscle. But here deltoid muscle has been mentioned. That means it is quite known that axillary nerve is injured. So one of the best reason and one of the most common reason in 90% cases, anterior dislocation of humerus and the nerve being compressed is axillary nerve. So we will go with A as the correct answer. So in this case we have got A as the correct answer. This is a case of anterior dislocation and the nerve being involved is axillary nerve. The nerve being involved in this case is axillary nerve. Got it? Okay. So acromioclavicular joint is not the answer because normally nerve is not involved. Clavicular fracture also normally nerve is not involved. Spiral fracture of humeral shaft will lead to involvement of radial nerve and that of profunda brachii artery. Fracture of coracoid process will lead to the involvement of muscle, that is coracobrachialis muscle, and short head of biceps brachii. Got it? Now, rotator cuff tear is not the answer. If rotator cuff is tear, the most commonly muscle being teared is supraspinatus. And we know that the nerve supply of supraspinatus is suprascapular nerve. So this is not affected in this case. So the most correct answer is A, anterior dislocation of humerus. So my dear aspirants, let's move on with this explanation. See here. In this case, the glenohumeral joint, shoulder joint, is most commonly dislocated joint in our body, and the reason of most common dislocation is that it is having a shallow glenoid fossa which is articulating with the humeral head. Okay, anterior dislocation of humerus and following a prick. Okay, so that will lead to involvement of axillary nerve which is giving innervation to deltoid muscle. So at the case of external rotation, adduction of arm at the shoulder, this all lead to involvement of anterior dislocation and involvement of axillary nerve. So it will lead to paralysis of deltoid muscle and teres minor muscle. So my dear aspirants, other than that, I also want to tell about subluxation. Okay, the word subluxation means displaced from its original position. Tripti, displacement from the original position. Slight displacement from the original position. Tripti, is it okay? Slight displacement. Now, when the head of humerus is displaced anteriorly, there is flattening of the deltoid prominences and also the affection of acromial prominences in the axillary fullness. Okay. Now, my dear aspirants, we know that axillary nerve is not only giving innervation to deltoid muscles and teres minor muscle, it is also giving one of the cutaneous nerve, that is upper cutaneous nerve of the arm. So, axillary nerve is commonly injured in anterior dislocation causing flattening of deltoid muscle and due to upper lateral cutaneous nerve of arm. So, upper lateral cutaneous nerve of arm is the branch from axillary nerve. So, cutaneous sensation over deltoid muscle is also affected in this condition. Got it, everyone? Yes. So, let's move on to the next, that is question number 10th. A 44-year-old man is admitted to the emergency department with excessive vomiting and dehydration. The complaint is excessive vomiting and dehydration. Clinical anatomy, snail's anatomy. You can go with clinical snail's anatomy. Students' Gray's anatomy is also good. Okay, last anatomy, student Gray's anatomy, snail's anatomy. Otherwise, I am there to explain all clinical aspect, don't worry. A 44-year-old man is admitted to emergency department with excessive vomiting and dehydration. Excessive vomiting and dehydration. Radiological image demonstrate that the part of the bowel is being compressed between abdominal aorta and superior mesenteric artery. So this is a case of nutcracker syndrome. Welcome dear Tripti, this is a case of nutcracker syndrome. A part of bowel being compressed, here the compression is occurring between the abdominal aorta, superior mesenteric artery, and bowel means a loop, intestinal loop is also compressed. So which of the following intestinal structure is compressed in case of nutcracker syndrome? Whether it is second part of duodenum, whether it is third part of duodenum, whether it is transverse colon, jejunum or first part of duodenum. So you have to tell me in nutcracker syndrome which part of duodenum is involved. Important demonstration is that a loop is involved compressed between the superior mesenteric artery, abdominal aorta. So which is the best answer dear? Please mark the correct answer. 5 options are there. Question number 10th. The third part of duodenum is the correct answer. Let me explain it. Third part of duodenum is the correct answer. See here. Nutcracker syndrome should not be confused with superior mesenteric Wilkie syndrome. Actually, here the superior mesenteric artery compresses third part of duodenum. Okay. So actually the nutcracker syndrome is involving which part of duodenum? Third part of duodenum. Actually your image will be explaining here. First see, this is the here this is the second part, this will be the third part, and you can see in relation to the third part of duodenum, anteriorly we have got superior mesenteric vessels and root of mesentery and coils of jejunum. Posteriorly the third part of duodenum is related to psoas major, right psoas major, right gonadal vessels, right ureter, inferior vena cava, abdominal aorta and inferior mesenteric artery. So actually you can see, so this is the diagram which is showing you relation of third part of duodenum. It is showing relations of third part of duodenum, both anterior and posterior. Now in case of nutcracker syndrome, Arundhati, C, absolutely correct Arundhati. So here you can see in the nutcracker syndrome, you can see the part of duodenum which is involved is third part of duodenum, which is compressed here by superior mesenteric artery and abdominal aorta. Okay, so you can see compression of third part of duodenum is seen in case of nutcracker syndrome. It's a case for nutcracker syndrome. Okay, my dear aspirants, before ending the session, today two MCQ session I have taken High Yield Anatomy MCQ. I always come up with special free session on the Unacademy platform. So be connected every time. I will take a session of free sessions on Friday, Saturday, Sunday and also on Wednesday. And also on YouTube, my free sessions are going on and it will be followed by open house discussion. So today also I have finished clinical High Yield Anatomy MCQ session which was 4 p.m. Now I will connect in another 3-4 minutes, in another 2-3 minutes we will be connected on the Unacademy app. All of you open your Unacademy app and get connected with me for open house discussion. Open house discussion today I will tell you about important topics not to be left in lower limb. All important topic I will tell the points which you should not miss out in case of lower limb. Okay, so the students who who want to take the subscription or who want to see the free sessions can join by using code ANAT10. Also, I want you to give information regarding mock test. Okay, so there is All India mock test on 19th Feb 9 am. 19th Feb 9 am there is All India mock test. Okay, there is All India mock test on 19th Feb 9 am. So be connected, use the code ANAT10 for it and be connected for it. Use the code ANAT10, get enrolled for 19th Feb. Get enrolled for 19th Feb All India mock test. 9 am is the timing. 9 am is the timing. Got it? My dear aspirants, this is the pricing detail. What you are seeing is the pricing detail of Plus and Iconic which has been shown here. This will help you to decide which subscription you want to take. Use this code ANAT10. Okay, and be present for this for all my free session and also take an extra 10% discount. Thank you, all the best. All of you connect for my next session, that is open house session, Unacademy app. Open the Unacademy app and get connected for it. So that will be seen here. So you can have the code NAT10 and get 10% discount. So all of you get connect for the open house session. Open your Unacademy app and get connected. All the best. Okay, all the best, dear. Open house session now. This will be on Unacademy app. This will be on the Unacademy app. Okay, this will be on the Unacademy app. So if you want, I will also give you the link. Thank you everyone.